snoring is still a problem in your home, there is a device called an oral appliance that may just help. Dr. Craig Schwimmer, the medical director of the Snoring Center, is here to explain how it works and if it works. Craig, good morning to you.
Good morning, Amy.
All right, we've talked about so many different treatments the Snoring Center provides, but never this one. What's the deal with the appliance?
You know, it's funny, I was thinking about that because we've spoken about these issues so many times, and we do provide oral appliances at the Snoring Center, and yet we haven't discussed them before.
Yeah.
And I think that's just because we don't really view them as ideal first-line therapy, so that there's something that we call upon, but kind of only when we need to.
Okay, so how exactly does it work to prevent snoring?
Well, oral appliances are fashioned by a dentist, and basically, you know, you get a little bite plate that's made for your upper and a lower, and they're attached by a little spring mechanism.
Yeah, right, like this.
And you just kind of pop that in your mouth, and you wear it while you sleep.
So it's in your mouth like this?
Exactly.
Oh, is it a magnet? What's going on here? Oh, it's
no. There's a little clamp.
Oh, it's a clamp. Okay.
And, yeah. And there's,
gosh, imagine that. Your mouth is like, that's why you don't snore. You can't breathe. Okay, well, so you stick this in your mouth.
And that's exactly the issue, is that you have to sleep with this.
Okay.
And, you know, we've talked an awful lot about how so many patients can't or won't tolerate CPAP, the mask. Well, a similar problem exists with these. And so, while these can indeed be effective for both treating snoring and sleep apnea, studies show that for sleep apnea, they work about half the time. And for snoring, about 80% of the time. The issue really is that people only wear them about half of the time.
So you've got to be cooperative, certainly. Just like the CPAP, like you said.
Human beings just aren't good at doing things that they find unpleasant on a regular basis.
Okay, so it's moving your jaw? Is that exactly how this technology works?
Yes, so it pulls your lower jaw forward. And the reason that they work is that your tongue is attached to your lower jaw. So when you pop this in at night and you go to sleep with your lower jaw thrust forward, it pulls the tongue forward and that opens up the airway. And as I said, that really, it can be effective. The problem is getting people to wear them. And then if you do wear them, because they pull the jaw forward, they can cause some jaw joint issues down the road or some shifting of the teeth. And
I'm assuming when you wake up in the morning, you might be a little bit sore?
That's a common occurrence, yes.
Okay, and it kind of looks like my Invisalign or my husband's grind plate that he wears at night. So this kind of reminds me of like something I'd get at the dentist, which doesn't seem like it would cure snoring.
Exactly, and so typically these are fabricated by a dentist under the direction of a physician, and that's so at the Snoring Center. Yes, we work with a dentist. We sort of guide him in treatment choices, and as necessary, we will use these. But again, our philosophy is human beings being what we are. If it's possible to solve the problem with a minimally invasive office-based procedure where there's no compliance issue, where the patient doesn't need to do anything or wear anything or put up with anything that's unpleasant, that's ideal.
Yes, because I know I don't wear my Invisalign all the time and I'm supposed to. And I know that, you know, because it's an elective thing, I can take it in and out, not like braces, that I don't wear it as much. I'm not wearing it right now.
Exactly, and that is the issue. And so in our philosophy, if you can solve the problem and let the patient go home and not need to wear anything or do anything, particularly wear or do something that may be unpleasant or uncomfortable or not sexy, that's the ideal situation.
And the pillar procedure is minimally invasive. It doesn't hurt and it's really effective. But do you think people shy away from that because it's the unknown? They think, well, I have to go and have a procedure done, so they say, oh, just give me this retainer?
That may be part of it, and mostly it's, you know, it's an educational process, and the pillar procedure is one of the things that's often helpful, that helps with the soft palate, as we've discussed. There are a variety of other minimally invasive procedures, the coblation for the nose and laser tonsillectomy, and so you know, it's very often possible now to effectively treat people and not need to send them home with something to wear or do or tolerate.
So they just need to come in and have a consultation to see how often are they snoring, how much of a problem is it, how invasive in their sleep is it to themselves and maybe their bed partner?
Exactly, and now actually up on our website we've got some new sort of interactive quizzes that patients can take, and they can sort of assess their own situation at home and say, okay, yeah, you know what, this is an issue, I better go in and see what's going on.
All right, very good. So maybe an option for some, but not for certainly the first line of therapy, like you said.
Exactly.
Okay, sounds good, Craig. Thank you. And if you want to find out more about the oral appliance or any of Dr. Schwimmer's other snoring options, just log on to snoringcenter.com. And remember, Dr. Schwimmer has offices in Dallas and Fort Worth. And we will be right back.